I'm Dr. Sushma Raja, the retina consultant from Sri Shankara Nethralaya, Miyapur. Today I'm here to create awareness about the most ignored and underlooked disease of the retina, that is AMD or ARMD, Age-Related Macular Degeneration. AMD is the leading cause of severe blindness among people above 50 years. AMD usually doesn't cause total blindness, but it can severely impair the central vision among some people. AMD is classified as dry and wet type. Dry AMD is much more common, accounting to 85 to 90% of patients with AMD. It usually progresses slowly. Wet AMD is much less common, accounting to 10 to 15% of patients with AMD. It accounts to more than 80% of patients with legal blindness, which is considered as patients with severe vision loss. It causes rapid and sudden loss of central vision. The risk of progression from dry AMD to wet AMD is 1 to 4.7% in 1 year and 13 to 18% at 3 years. So they need to be careful, watchful, and they need regular follow-ups with a retina consultant preferably. Those at risk of AMD are age above 50 years, those with family history of AMD, smokers, obese and hypertensive patients. Now let's discuss about the symptoms of AMD. Dry AMD initially will not have any symptoms, but later the patient will develop blurry central vision, dark spots in the central vision, and they start seeing straight lines as baby lines. And wet AMD patients will have severe rapid loss of central vision, which can happen within weeks to months. Coming to the diagnosis of AMD, which is usually done by after the dilated fundus examination by a retina specialist. Dry AMD will have drusens, which are bright yellow spots in the central retina, which is macula, along with RPE or geographic atrophy, which is thinning of the retina, the central retina, which is called macula. In wet AMD, there can be abnormal blood vessels or membrane growing underneath the retina, which is called as CNVM or choroidal neovascular membrane. There can be bleeding or fluid within the retina too. Coming to the three normal, common, regular investigations which are usually advised by the retina specialist. The first one is fundus images, which is the color retina pictures. Next one is FFA, fundus fluorescein angiography, and the third one is OCT, optical coherence tomography. Coming to the treatment of AMD. Dry AMD is usually treated by identifying and rectifying the risk factors along with the oral antioxidant, vitamins and zinc supplements. Wet AMD is usually treated with anti-VEGF injections, which are given intravitreally inside the eye. So they are usually given monthly. It requires 3 loading doses, later followed up by regular follow-up, proper investigations and timely treatment, preferably by a retina specialist. So kindly get an eye examination or a retina examination as soon as possible by an ophthalmologist or a retina specialist to rule out AMD, and please be aware of AMD. Thank you.